So hello everyone. As you may know, last Monday we did a Facebook Live about vaccination and for people with diabetes. And during that session, we had lots and lots of questions about shielding, which we didn't have time to cover then. So today we're going to run through a few of those questions and hopefully clear things up a bit. So I'm Lucy, I'm Head of Research Communications, and I'm here with Dan, who's our Head of Care. And hopefully, we can help you understand a bit more about shielding, which has been a big topic of this week and last, because we know that some people with diabetes have received letters or emails asking them to shield when they haven't been asked previously. And the reason why people are now being invited to shield is because NHS England is using a new tool, a risk calculating tool called Q-COVID. And what this tool does, it's basically takes all the known risk factors for becoming really seriously ill from COVID, brings them all together, combines them mathematically and gives you a score, an individual score about your risk of becoming seriously ill from COVID. So the risk factors it takes into account are things like your age, which we know is a really serious, the strongest risk factor for becoming ill from COVID. Your sex, your BMI, your ethnicity, where you live, and it also takes into account lots of health conditions that you may or may not have. And one of those health conditions is diabetes. So taking all that information together, this tool gives you your individual risk score. And based on your risk score, you may or may not have been asked to shield. So there'll be a certain threshold that people have been asked to shield reached. So if you've been asked to shield, obviously that's because your risk score showed that you probably need extra protection from COVID. And this will also give you some extra financial support. So give you the right to furlough and statutory sick pay. And it will also bump you up the vaccination list as well. So at Diabetes UK, we think this tool is really great. It's helping people with diabetes who are at the highest risk of becoming seriously ill from COVID get the support they need, which is something we've been campaigning for a long time now. At the moment, the tool's not being used in other nations, so it's just been used in England, but we hope to see it rolled out more widely soon. So that was just a little bit of background about the new risk calculator and the reasons why people have been asked to shield previously when they haven't been before, and it's because this risk calculator is now being used by the NHS. So now I'm going to move on to some specific questions. So the questions that came through on Monday, one came through from Lee, and Lee asked, are all diabetics getting added to the shielding list? Dan, would you like to take that?
Yeah, sure. Thanks very much, Lee. And as you'll have heard from Lucy's great introduction, the answer is no. Not everyone with diabetes is being added onto the list. Having diabetes alone doesn't automatically mean you need to shield. You're only advised to shield if you have one or more of some medical conditions which the government have said makes you clinically extremely vulnerable. And then your GP has asked you to shield maybe because on their own clinical judgment, your GP might know you much better than the government does, so they might have asked you to shield. Or if you've been identified through this new risk tool. And as Lucy said, diabetes alone isn't the thing that's bumping your score up. We know that risk of getting serious complications from COVID is very much dependent on certain risk factors, and the main one being your age, but other things such as diabetes, your ethnicity, even where you live really as well, can bump you up that risk. So that the risk tool is being used, and it will highlight people as having diabetes and then also look at other things. It might even look if you're on blood pressure tablets, or if you've had diabetes complications in the past, or if you're in hospital recently. And those are things that might bump you up. So not everybody is being added to the shielding list. And remember, you don't have to shield when you've been asked to. It's a total personal decision. But being on the shielding list means that, as Lucy said, you are entitled to certain things. So it might mean that you can make an easier decision about whether you can go to work or if you can't work from home. So that's really why it's a a really good thing.
Thanks, Dan. So as Dan was saying there, I think the important point is that not everyone with diabetes is not the same. We're a complete variable bunch, and risk differs very differently between people with diabetes. So there's lots of different ways now that we can hopefully identify those at higher risk through the Q-COVID tool or through individual conversations with GPs. But just because you have diabetes doesn't mean you're at higher risk. It depends on all the other risk factors that you may or may not have as well. Lovely. So the next question was from Maria, who asked, are all type 1s being asked to shield? I haven't had a letter, but I know lots of other type 1s who have.
Yeah, as with the last answer, Marie, not all people with type 1 will be asked to shield. So they will take into account the type of diabetes, but it's not as big a risk factor as other things such as your age or your past medical history, your diabetes complications if you have or haven't had any. So it's not standalone type 1 diabetes. Now, we're aware that the risks might vary between people with type 1 and type 2, but having diabetes alone doesn't put you in the shielding group. Is there anything you want to add, Lucy?
No, I think you covered it beautifully there, Dan. Should we move on to the next question, which was from Kerry, who has type 2 diabetes, and she asks, I've not heard anything about shielding. I work in a school, and now knowing that the children will be returning, so will be amongst a full class, is really worrying to me. What can I do?
It's a really good question. We have had a lot of people that are working in schools, teachers, classroom assistants, and so on and so forth. But again, Kerry, your type 2 diabetes alone won't mean that you need to shield per se. The risk tool that has been used in England, or your GP, if you're in any of the other nations, your GP might have said, I think it's a really good idea for you to shield, which is fine and great, but it's not based solely on your diabetes. If you think that you should be shielding, and if you are particularly worried, you should really talk to your GP or your hospital clinician, your diabetes teams, to see whether shielding would be a wise move for you. Again, they'll base it on many things, not just your diabetes. Lots of people, as I said, have said to us that they are concerned about being in school, and that's totally, completely understandable. But if you're worried about going to work, your employer needs to take the right steps to make your workplace safe, and to minimise risks to employees like yourself. And that means them doing their risk assessment. Now, they'll probably be doing them constantly in schools. But we've got a useful checklist that you can ask, or that you can take or show to your employer, that you can go onto our website at diabetes.org.uk/work. I think we might try and put that link in somewhere around this video. And that template will explain the things, the reasons why you might need to have extra support to keep you safe. And if all else, if you need to speak to somebody about this, Kerry, please get in touch with our helpline. And again, the number will be around this video.
Thanks, Dan. So the next question's from Colin, and he says he doesn't want to shield because it's too late for all of that. Does he have to? I think there's quite a few people are feeling the same at the moment. What's your advice, Dan?
Yeah, I can totally understand it, particularly even more so now we're looking at the kind of the light at the end of the tunnel, for want of a better word, that we're all talking about the things that are opening up and stuff like that, and then being told that you need to shield, you might feel a bit left out. Well, shielding isn't mandatory. The shielding program is there to help protect those who are the most vulnerable and at most risk of severe complications from the coronavirus, but it's also there to help support you maintain a healthy life, as in not go to work if you can't work from home, and get an extra support to have things like your medications delivered to you and so on, or even get priority booking for groceries and things like that. But if you have been identified, you'll get a letter that will give you all of this information explaining to you. And if you do take up the offer to shield, local areas will be in touch to tell you exactly what you can get. But by no means is shielding mandatory. If you're told to shield and you really don't want to, you don't think you need to, then you don't really need to. If you're worried about it though, give us on our helpline a ring, or speak to your GP and ask for a bit more of an explanation as to how you've come up with this idea that you need to shield.
Thanks, Dan. I think that last point's really important, because there may be things that you don't know put you at high risk that are putting you at high risk that this Q-COVID tool has pinpointed, and it'll be through a conversation with your GP that you'll get to understand better about why you might have been put in the shielding category. So always good to chat things through. So the next question's from Stevie. Stevie asks, may you explain the scoring of the risk stratification of the Q-COVID risk tool in the context of diabetes? Is the tool completed with the patient or just on the evidence within patient records? Thank you, Stevie. Very good question. So as I explained at the start, the Q-COVID tool takes into account lots of different risk factors and gives each person their own individual risk score, so the risk that they are likely to develop serious illness if they get COVID. And depending on that score is whether you'll be asked to shield or not. So diabetes is one of the conditions included in the tool, so that will bump up your risk a bit, but it doesn't. But obviously there's other risk factors that will come together to give you your total score. So there's lots of other factors that take into account. So diabetes on its own, as Dan explained earlier, doesn't mean you're automatically going on the shielding list. And the tool is used in a way that it goes through patient records automatically and works out this risk score. So it's not designed to be completed by the patient. It's a tool designed for healthcare professionals. So there's lots of information on the NHS website about how the tool was developed and the kind of complex algorithms behind it, and information about who's meant to use it and how and why. And you can also speak to your GP and they'll be able to explain a bit more about the tool as well. Anything to add there, Dan?
No, I don't think so. I think it's just really worth pointing out that we know very much that people with diabetes are very different to each other. So that's really why diabetes alone hasn't caused the alert to go off to say that you need to shield. Diabetes alone does increase your risk, but not to that high risk factor. It's other things. And, you know, one person's diabetes is very different to another person's diabetes. So if you're listening to this and you do think, well, you know, my diabetes is similar to my next door neighbours, you know, they might have other things going on inside them that means that their diabetes has caused them to go up in the risk factor score.
Thanks, Dan. So the next question is from Deb, and Deb has asked, why are people who have gestational diabetes being asked to shield when they haven't got it anymore? Do you want me to start off with this one, Dan?
Yeah, sure.
So this is a good question, and I know there's been a lot of confusion about this. I've seen the posts on social media. We understand a bit more about what's been going on. We've been talking with NHS England. So what we know is that in England, the Q-COVID tool has identified some people who have had gestational diabetes in the past, and it's said that they are at higher risk. And because of this, they've been asked to shield. And if you've had a letter or text unexpectedly, try not to panic. Remember that shielding is an important way of protecting you, but it's not compulsory. And we know that for some people who have been contacted, shielding is appropriate. So yes, they had gestational diabetes in the past, but they're likely to have had other risk factors that have come out through the Q-COVID tool that means they should be shielding and protecting themselves. But we're also aware, because of the way GP and Q-COVID codes have been used in the Q-COVID risk score, that gestational diabetes has come out in the system in a way that makes it put some people in a higher risk category where maybe they don't need to be there. And the NHS have done it this way to take a kind of precautionary approach. So to be on the safe side. But again, if you feel like you're being told to shield because you've had gestational diabetes, but you feel like you haven't got the other risk factors, again, it's not compulsory, and it's probably worth a conversation with your GP to understand a bit more why you ended up in that group.
Absolutely. I think the the coding but it can be quite confusing to understand. But essentially, whenever we have, when you're registered at a GP, the GP will put into their system whether you have diabetes. That will give you a particular code. And there's actually quite a few different codes to talk about diabetes. So when this Q-COVID risk tool has looked at all of these codes, in some places it might have seen gestational diabetes. It might have been coded as diabetes. It might have been coded as gestational diabetes or transient diabetes, which means that it goes away. So that's why some people have received that. And as Lucy said, those risk factors of developing gestational diabetes or for developing type 2 diabetes are also some risk factors that increase your risk of severe complications from COVID. So have that conversation with your GP. If you no longer have gestational diabetes and if you're not pregnant, then you probably need to just speak to them and say, you're giving me this by mistake. It's worth noticing if you are pregnant and you've had gestational diabetes in the past and you're currently pregnant, then it might be the pregnancy alone that's pushed you to get the letter or the text or whatever that may have been.
Exactly. Thank you, Dan. So question from Gemma. Gemma's asked, do you need to be invited to have the vaccine? Or if you have been told to shield, can you book it anyway?
Good question, Gemma. Well, in England, it means if you've been told to shield, it means that you've been identified as being clinically extremely vulnerable. So you don't need to wait to book your vaccine. You can go onto the NHS website, which is nhs.uk. It will ask you whether you've been told to shield, and then you'll just click yes, and then you can book your vaccine that way. It'll ask for your postcode, so it'll tell you where the nearest vaccine centre is. In Scotland, in Scotland, Wales and Northern Ireland, in fact, your GP, your local health board, will be getting in touch with you. So they've asked for people to not contact their GP practice or NHS health board until you've had a message to say, go to this link, book yourself on. Or they might just phone you and say, we've got appointments at here or there at this time. So just hold fire. They will be getting round to everybody. That is the intention, to vaccinate all people with diabetes by the end of April. So we obviously not there yet, so just give it some time and let's see how we get to it.
Thanks, Dan. So I think that's it for all the questions. We hope you found that helpful. If you've got more questions, please do give us a call on our helpline, which is open every day from 9 till 6. We've also got lots of information on our website around coronavirus and diabetes, including shielding and vaccination. And you can also contact us through our social media channels. So it's bye-bye from me.
And bye-bye from me. Thanks, Lucy. Thanks, everyone.
Thanks.